All right, we're going to go ahead and get started. Good afternoon again, everyone, and thank you for joining us today. We really appreciate you all coming together with us to learn more about the Early Intervention Program. And we are so grateful for our special speaker today. And I really look forward to having an in-depth conversation, in-depth opportunity to learn more about the EI programming. My name is Angel Gray, and I am the Program and Policy Manager here at Westchester Children's Association, which is a multi-issue child advocacy organization, where our mission is to improve the lives of Westchester's young people by shaping policies and programs to meet their needs and by keeping their well-being at the top of the public agenda. And our vision is for every child to be healthy, safe, and prepared for life's challenges, regardless of race or zip code. And we've been doing this for more than 100 years. We're truly committed to ensuring that there are policies in place to support children, starting from our youngest, going up to our young adulthood, because we know how important it is to make sure that our children are at the forefront of the agenda because they're very much the future and they will occupy all of our spots at one point in time. So we truly do need to make sure we are remaining committed to supporting their futures and providing the resources and supports they need along the way. Next slide, Nora. So at WCA, we are a data-driven advocacy organization. So what we do is we collect and analyze data. We track the numbers to see who's being impacted, how they're being impacted, how long they've been impacted as well, to really determine how we're going to drive our advocacy efforts and look at public policy and have public policy engagement to ensure that they are remaining at the forefront of the agenda. Once again, we analyze the numbers, and then we amplify the stories behind the numbers while mobilizing community members because we know that we need to amplify those voices. We cannot advocate for an issue without having those who are impacted directly by that issue at that table. So we analyze our data, engage on public policy, and then we also mobilize community members to ensure, again, that their voices are at the forefront of every conversation. And overall, we're just looking to educate, connect, and really acting to move things forward and create policies, once again, that support children and families across Westchester County and New York State as a whole. Next slide, Nora. And this opportunity would not have been made possible without support from our great sponsors over at Valley Bank. And I want to take the time to allow Caitlin Chinizzi to kind of introduce herself and have a few words as well.
Good afternoon. Thank you, Angel. And thank you to Westchester Children's Association, Nora and Angel, for the incredible work that you do and the continued awareness, advocacy, and care that you provide for children and youth within the Westchester communities. We truly appreciate your continued partnership and all that you do. I'm Caitlin Shalizzi. I'm Senior Vice President of our Corporate Social Responsibility and CRA team at Valley Bank, and I oversee New Jersey, Westchester, California, and Chicago. At Valley, we are committed to expanding access to capital, supporting affordable housing, strengthening small businesses, and partnering with nonprofit organizations to foster meaningful and sustainable community growth and local impact. Community reinvestment and community engagement is core to who we are as a financial institution. Thank you again to Westchester Children's Association and all that you do for the communities and your continued partnership. Marina, looking forward to your presentation, and please feel free to connect with me after the presentation. Thank you.
And without further ado, the reason why we have all gathered here today is so that we can hear from the one and only Marina Yogo more to hear and learn more about early intervention programs. And just to give you a little background about Marina, here we are. Marina Yogo is a New York State licensed speech language pathologist with certifications as a public school teacher in special education and in school administration and supervision. She currently serves as the Assistant Commissioner of the Children with Special Needs Division at the Westchester County Department of Health, overseeing programs for children with special needs from birth through age 5. With 30 years of experience in early childhood programs, early intervention, and preschool special education, Marina has worked extensively as both a clinician and an administrator. In addition, Marina is an adjunct professor of speech language pathology at New York Medical College School of Health Science and Practice for their speech language pathology program. Marina, the floor is yours.
Thank you, Angel, for that wonderful introduction. And also thank you for the opportunity to talk today about the Early Intervention Program in New York State, which is a vital program for infants and toddlers with special needs and their families. Today's presentation, I hope to provide you with information on the structure and legal authority of the New York State Early Intervention Program, what the administrative roles at the county level are, at the state level, the steps of the program from the referral to developing services for eligible children, and program challenges with respect to EI workforce, fiscal issues, and continued efforts at both the state and county level for program improvement. So the New York State Early Intervention Program, this is a very quick overview, is a program for infants and toddlers with developmental disabilities and their families. It's Part C of the Federal Individuals with Disability Act, IDEA, Title 2A of Article 28 of Public Health Law, which was implemented in 1993. The New York State Department of Health, Bureau of Early Intervention, is the lead agency responsible for the administration and oversight of this program statewide. All 57 counties and New York City have a designated early intervention official who is responsible at the local level, which here is obviously Westchester County Department of Health, to administer the program. The early intervention program services are in New York State. We serve approximately 70,000 children annually, costing about $680 million statewide. Early intervention program services are delivered to eligible children and their families by the New York State Bureau of Early Intervention approved providers. So in order to deliver these services to these children, everyone must be approved who wants to be an early intervention provider must be approved by the New York State Department of Health. Next slide, please. So the mission of the Early Intervention Program is we identify and evaluate as early as possible infants and toddlers whose healthy development is compromised and provide for appropriate interventions to improve child and family development. We teach and coach the primary family or caregiver how to meet the needs of their child, and we provide families with community resources to maximize their child's ability. Next slide, please. So the requirements of the early intervention program is a child must be under 3 years of age. They must have a diagnosed condition with a high probability of resulting in a developmental delay affecting function in one or more areas of the 5 areas of development, which are cognition, physical, communication, social, emotional, and adaptive. In New York State, there's no out-of-pocket costs for services for families. However, we are required to collect, under the Early Intervention Program, to collect insurance and Medicaid information from families. Services are provided by the early intervention providers approved, as I mentioned earlier, and contracted with the New York State Department of Health, Bureau of Early Intervention. It's not a medical program, it is a developmental program. Slide, please. So the referral to the early intervention program. So we start with the referral to the program because how will our families otherwise know that we are here and that we are available to help them? So every municipality and the Department of Health at this local level here in Westchester is a single point of entry for a child referred. So referrals can be made by parents, physicians, nursery schools, essentially anyone who touches the life of a child, and the referral can be made unless the parent objects. So here the idea is that a parent has to be informed by the referral source that they would like to make a referral on behalf of their child to the early intervention program. It's not a written consent, it's a verbal consent, but the parent has the option of objecting to the referral. And if they do, the referral source certainly cannot make that referral. However, the responsibility of the referral source source is also that within 2 months of the referral itself, they do circle back to the family and ask them, how are you doing? Are you still interested? How's your child doing? Would you like us to refer? Or we can give you the information and you can do that on your own. So the idea here is that referrals can be made by others other than the parent, but the family must agree, and if they object, you cannot. Oops, sorry, just go back to that last slide. 1 second. So a multidisciplinary evaluation must also be completed to determine initial program eligibility. So we have a referral that comes through, and then we have to complete a multidisciplinary evaluation to determine eligibility. And if that child is determined to be eligible, we convene an individualized family service plan meeting, which is an IFSP, and that has to happen 45 days, no later than 45 days from the date of referral, which is a federal requirement. And once that plan is put in place with services like PTOT speech, because that might be the plan, those services also have to be secured within 30 days of the date of the IFSP meeting, which is also a federal requirement. Next slide, please. So this early steps to early intervention, it's the parent guide that the State Department of Health issues for all families. It's a wonderful, wonderful document. I encourage anyone who actually works with children and families to refer to this document because it will help you understand the early intervention process. As you see, that backward S where it says early intervention steps chart, we love this backward S because it really describes step by step the process from the referral all the way to when a child transitions, which we will be talking about a little later on as the presentation goes on. But this is a great visual representation for families. It gives them a first really good view of what could happen. Many times our families are afraid to make a referral or just don't know what that's going to be looking like for them. And it's complicated. These systems are complicated. They have a lot of steps to them, a lot of rules. So this is a great tool. So I encourage everyone to kind of take a look at this and make it your friendly companion if you're working with children and families. I think that's a great idea. And that can be found on the New York State Department of Health website. It's there for families. Next slide, please. So here, I'm not going to review all of these, but these are pretty much all of a good number of referral sources that can make a referral to early intervention, again, unless a family objects. Next slide, please. So just to give you now an idea of how early intervention operates at the local level, because we are a municipality who is responsible as a single point of entry for all our families coming in. So we have to have a structure that defines certain roles and responsibilities of those that are in the program to serve families. So the early intervention official, we start with that and appointed by the chief executive officer of the municipality. So in Westchester County, I am the early intervention official appointed by the county executive to operate the early intervention program for Westchester County. Then I, as an EIO, as would my colleagues in other counties across the state, and also depending on the size of their counties, as an EIO, would have to designate my designee. So that's where that D comes in. So that's why we now have an early intervention official designee. That person, that designee to the EIO, acts on behalf of the EIO to ensure that eligible children receive timely services for early intervention, that, they are ensuring that families are informed at every single step of the way. Currently, Westchester County has 14 early intervention official designees here in Westchester County who approximately have 180 cases each. So the 14 of them, that number sometimes, depending on who's going to I always say retire soon because it happens quite a bit. We're lucky to have 14 now. They're seasoned, they're excellent at what they do, and they ensure that, their families are getting what they need in early intervention. So they also have to ensure that eligible children receive timely services. So we have a charge as an early intervention program to absolutely ensure that that is happening through documentation received from providers, from service coordinators, which we'll talk a little bit about later. But it is our charge as a municipality to ensure that those services are happening in a timely manner. We oversee the process from referral to eligibility determination, and we develop the IFSP plan, and we authorize those services as required in the state regulations. So the early intervention official designee ultimately is the last stop before a plan is put in place, and the less responsible individual that ensures that that plan has met all of the requirements, that have addressed the family concerns, that we've done our evaluation and due diligence correctly, and that services are in place, and that plan then could be acted upon. And they also ensure family rights and procedural safeguards. And family rights and procedural safeguards are very vital to the early intervention program because they really do ensure that a family can disagree with any aspect of the program. They can dispute anything. They could feel that, we haven't met our timeliness correctly. They could, either to IFSP or service, they can not agree with the eligibility determinations. They could not agree with their plan, and maybe they want more PT or OT, and maybe there's some disagreement from the provider who's not making that recommendation, but the family then has that right through several family rights that they have, which is a systems complaint to the Bureau of Early Intervention, stating their case, which we all have to respond to, or mediation, which if that were to happen, we would go to mediation and have, that process to resolve the dispute, or an impartial hearing, which then that determination might be made by an impartial hearing officer. So that really is why the early intervention procedural safeguards and family rights are very important, because it ensures that the family has their voice and that we are responding to it. Next slide, please. So next slide. So there are two types of service coordination in early intervention. The first is initial service coordination, which happens at the time of referral. So when that family makes their referral to us, the early intervention official here, we assign that family to an initial service coordinator. And we have currently two agencies in Westchester County that provide the initial service coordination. And they assist the family through the IEP, the early intervention process, from the first 45 days to the day of the meeting. And what they're doing in that process is they're assisting the family by ensuring that we're addressing their concern. Why did they come to early intervention? What would they like us to do? Are they concerned about their child's speech development, their motor development? So they're addressing that. They're ensuring that the family is choosing an evaluation site, an approved evaluation site, approved by the Bureau of Early Intervention. We have a whole list of them that is provided to the family. They can choose the site who will complete that multidisciplinary evaluation, and that initial service coordinator ensures that that site is in the timeline of completing everything they need to do to get that family to that IFSP on time. They also ensure that not only that the evaluation is going to happen to determine eligibility on time, but that the family actually receives a copy of it, understands it, has reviewed it, has an opportunity to ask questions of the evaluation team, and we ensure that the parent is in agreement with the results of the evaluation. If they're not, one way or another, procedural safeguards step in. And what we tend to do prior to mediation or systems complaint and an impartial hearing, if the family absolutely disagrees with the findings of an evaluation where eligibility was not determined the way they agree with, or they have any aspect of disagreement with the evaluation, we can offer them a second evaluation to offset that disagreement. And again, parents do receive their procedural safeguards. And they are primarily, the parents primary contact throughout all of this process from day one of referral to 45 days. They ensure that there's collaboration and coordination among everyone serving this family, which includes the evaluation site, the EIOD, who's responsible for the case. They're informing the EIOD that, we're moving along the process, the evaluations are completed, the families are in agreement or they're not in agreement, and we're going forward. And anything that's happening within that 45 days, we resolve to solve so that we can get to that IFSP on time for that family, and we're meeting the family needs. And they perform activities necessary to enable eligible children and families to receive their safeguards and services. Next slide, please. And the second is the ongoing service coordinator, when this particular role is determined at the IFSP meeting. Once that eligibility has been determined and we're off to the IFSP meeting, part of that meeting is for the family to select their ongoing service coordinator. How that's done is a list of approved providers, again, by the Bureau of Early Intervention, a long, exhaustive list that we share with the family, and we help them select who they would like as a service coordinator to assist them during their child's time in early intervention. And the role of this ongoing service coordinator is to stay with the family either until the family fires them, which could happen because it's a family choice and the family can ask for someone else, which we would have to do, or to the end of that child's eligibility or exiting out of the program. And I have to say, we have very good ongoing service coordinators in Westchester County. Very few do get fired. However, sometimes families would like a change, and that's something easy for us to do. And the role is also to secure those mandated services as outlined in an IFSP. So the services, once the evaluation has been completed, a meeting has determined that the child is going to get PT, OT, or speech 2 times a week at the home setting or a facility, they're going out and they're looking to get those services in place within 30 days of the date of this meeting. They also have to ensure that once they've secured those services, that they are provided as the IFSP requires. So how they do that is that they'll do that through monthly calls with the family to check in, and these monthly calls are required in early intervention requirements, that they check in with the family to see that everything is going okay, that services that are in place, they're being delivered, whatever issues the family may have around the service provision, they're helping them to resolve it. They're preparing the family for the next meeting, which will happen at the 6-month mark. So they're securing progress notes from the providers of service who have been treating those children throughout the time. So they also have a critical role in ensuring that at any point in time, any other evaluations that a family might like or an amendment to the IFSP is also going to be something that can happen. So if a family feels that they had speech therapy only twice a week and their speech pathologist says, well, let's go for an increase or a decrease, whatever, or if there's a concern about, let's say, physical development, and they want not only the increase or decrease in speech, whichever they're asking for, or a supplemental evaluation for physical therapy because they think that there's a motor concern, that's how we'll amend the IFSP with the supportive documentation from the provider of service. And it's then given to the ongoing service coordinator who presents that documentation to the EIOD here at the county, the early intervention official designee, for approval. And one of their other major responsibilities is to begin the transition process for all children exiting the early intervention program. And what that means is that some children will exit the early intervention program because they've met their milestones, because a family decides to just exit, they're choosing not to participate. And in those cases, we provide the family with some community resources so that they can support their child when they leave the program. And the other formal transition process, which is a regulatory process more embedded in eligibility for children to remain in early intervention, that transition would be those children who are moving to the next system. which is the Committee on Preschool Special Education. So there are two ways that children exit the program. And currently there are about 130 service coordinators serving early intervention services as families, children and their families. Next slide, please. So program eligibility. So early intervention regulations are you can when you go to the New York State Early Intervention website, there's a whole section on EI regulations, and they're pretty clear, they're lengthy, and they're pretty detailed in terms of the requirements for eligibility. This is just like a quick snapshot to look at this and give you some information. So the EI regs require that multidisciplinary evaluations, or what we call an MDE, are conducted to determine a child's initial and ongoing eligibility in early intervention. And what that means is that initially children are coming in, we have to establish eligibility to determine that they are meeting it and they participate in the program. But let's say a child has been in early intervention for 6 months and they're doing very, very well, and their providers of service would like to discharge them because they've met their milestones and they are, you know, feeling that these kids are going to be okay. A family may disagree, and in that case, we have to determine ongoing eligibility to reestablish it, and criteria for both is outlined in regulations that has to be met in both cases. Again, it's a choice. The multidisciplinary evaluation must be completed by approved DI evaluation agencies that are contracted with the Bureau of Early Intervention. And again, it's a parent choice. And the multidisciplinary evaluation is performed by 2 or more professionals from different disciplines who are trained to utilize different methods and procedures, have sufficient experience in child development, and at least one who is a specialist in the area of the child's suspected delay or disability. What that means is that a parent calls and says, I'm concerned about my child's speech development. And we say, okay, so that's your area of concern. We help the family select the multidisciplinary team that's going to do the evaluation. That team will then know that the parent, through their own intake process, of course, and other things that they do, but will know that the parent is concerned about communication. So they will send out perhaps a special educator or a licensed clinical social worker or psychologist to do the areas all overall development, but the one who's going to address the area of concern has to be a speech pathologist. So that team would be an individual that would cover all of the areas of development and can be, again, a special educator, licensed clinical social worker, and then the speech pathologist who's going to address communication. And if it were motor, it would be the same for the general area, special educator, and then a physical or occupational therapist to address the area or disability that the parent is concerned about. And then once that evaluation is completed and eligibility has been determined, and the evaluation is ready for us to review, then the EIOD receives a copy of the multidisciplinary evaluation where eligibility has been established by that team. So we are not, at the county level, we are not determining the eligibility. The evaluation team is, and those are the regulations, and that's how the program works. However, the municipality is charged with ensuring that eligibility determinations are in line with regulatory requirements. So what that simply means is that when we're reading the evaluation to determine if that's been done, there's a whole bunch of stuff that we look at to ensure that correct tests were used, that the parent participated in the evaluation process, that there's enough information in the evaluation that tells us about that child's birth history, that there's a good overview of that child's functioning beyond just the testing that was used. So we get a comprehensive view of how that child performs. And we're also ensuring that the instruments that were used, if any, are appropriate for that child's age and disability. Next slide, please. So the program eligibility is determined by a diagnosed physical or mental condition that has a high probability of developmental delay. For example, a child born with Down syndrome, extreme low birth weight, which means less than 1,000 grams of birth, spina bifida, hearing loss, and blindness, as some examples. There are many others, and that's for the evaluation team to determine when they're doing their evaluation, if that is a diagnosed condition. So that's one way to establish eligibility. The other is if there's a developmental delay and then if that is the case, the following criteria has to be met. So if it's not a diagnosed condition, and if they're basing it now on determining a developmental delay, it would have to be 12 months in one or more functional areas, a 33% delay in one functional area, or 25 delay in two of each areas. And if standardized instruments are used during the evaluation process, a score of at least 2 standard deviations below the mean in one functional area, or a score of at least 1.5 standard deviations below the mean in each of 2 areas of development: cognition, communication, physical, adaptive, and social emotional. In addition to this criteria written this way, there also is a requirement to use informed clinical opinion. And that informed clinical opinion that the evaluator uses is that beyond the testing, because they just can't use testing alone, it's more than one method, but beyond the testing itself, they can include information about that child based on how that child functions within their development, any other information that might have about that child that helps them develop an opinion. They can be looking at clinical practice guidelines that the Bureau of Early Intervention publishes in areas of communication, vision, and hearing to help them define further beyond just the testing itself, the functionality of a child, and to do a really good behavioral observation of that child in context of the routines and activities that they are engaging with their family at the time of the evaluation. So all of that is important to the outcome of the eligibility criteria, and it's also considered beyond the testings. Next slide, please. So the same way we have a requirement to ensure eligibility for the program, that a family has been informed and that a family has an evaluation and that a parent has read it and agrees with it, the same thing will happen if a child is not found eligible for the early intervention program. And if that child isn't found eligible for the program, the parent does have an opportunity to meet with us and convene a meeting. It would not be a formal IFSP, but we would be meeting with the parent to determine what non-eligible resources we can give them that would support them in the community. But the family would have the right to dispute that. So the components of the information that has to be available to us for the ineligibility is that it has to be a clear statement as to why a child is not eligible. A parent absolutely has to understand how that child did not meet eligibility determinations the same way they would have to how that child does meet the eligibility determinations. And we have to have recommended resources and other services that might be available in the community for that child and family. So sometimes if a family's in full agreement and they're great, this is good news, my child is not eligible, but is there anywhere that I could take my child to help them continue with developmental milestones and just give them the opportunity to be with other children. There are community resources that we share with them, gymborees, gyms, play groups, things like that. We have a whole list that we share with families to provide them that information. And then if the last statement there is that if a parent chooses, we can also, if a parent chooses to want their child to be tracked for developmental milestones, we could either refer them back to their pediatrician, which some families like, or we here at the Department of Health and part of the early intervention program have a developmental and monitoring and surveillance unit that actually looks at children at risk. And what we do is we follow those families with ages and stages to continue to work with them if they feel that their child needs some support. And at any point in time, if they continue to grow and develop, a family feels more confident, they can, discharged from the program, or if in that period of time that child somehow shows some other developmental delays along the way, we actually make the referral from developmental monitoring right back to the early intervention program. Next slide, please. So the Individualized Family Service Plan is a written plan of early intervention services a child and family will receive. It's reviewed every 6 months and evaluated annually. And in order for that 6-month or annual review to take place, the family must have been provided with progress notes from all of the providers of service so that they're very clear at the time of the meeting what gains their child has made, what other needs they might have, but those progress notes are required in order for those meetings to be convened. It's a legal document for mandated services and determined by the IFSP team to maximize the child's development. So any determination of services within that plan is the parent and the team that's with them, PT, OT, speech, social worker, special educator, whomever it is, making the recommendations to us to change the IFSP, to increase it, to change a program, whatever they're asking us to do, that is determined by that IFSP team. And the parent is the focal part of that team. That's why there's an F in our plan, because the family is at the center of what we do. So the Individualized Family Service Plan. It's flexible, it can be amended at any time, and again, based on the documentation. So if a review takes place today, and we're going to plan to review it in 6 months, from today to that 6-month period, any time in between, a change can happen, and that's re-amended based on that change. So it's fluid, it's flexible, and it meets the family needs at all points. Next slide, please. So these are just some things that we always like to include to ensure that there's an understanding that an IFSP is very much a legal document and really does, it needs to do a job here, right? So we need to have a statement of family strengths, priorities of concern so that we're addressing throughout the IFSP. We have to have measurable outcomes, and those are expected that are expected to be achieved by a child and family, including a timeliness as defined by the parent. That means that at that meeting, the IFSP meeting, the team is developing these measurable outcomes, and they are outcomes that a family develops in their own words for them to be able to meet their child's needs within their child's routines and activities of the day. So they're out of clinical, obviously, goals that a speech language pathologist might have, but they're practiced by a family as a family child outcome because it's something practical that they could do. So it specifies the early intervention services. Every plan has to say PT, OT, speech, twice a week, 30 minutes, facility, home community, wherever we're going to provide that. It has to be very specific. And a statement of other services. So not only the early intervention services, which we are required to reflect and have in our document, but if these children and families are being served by other community programs, that we ensure that we have some information and we can engage with them. So if we have kids in Head Start, early Head Start, if we have kids who are being seen in mental health programs, things like that, we like to include our team as well so that there is a continuity for the family to be able to have a more holistic approach for their child as they receive their early intervention services. And a statement again of supplemental evaluations, meaning that if a family thinks that they need another evaluation to help support a need that they might have, we're going to go ahead and put that in place, and a transition plan. And the transition plan we'll talk a little bit about in more detail in a few minutes, but that transition means, as I said earlier, those kids going to the next system, the Committee on Preschool Special Education in their local school district, or kids just exiting the program. Next slide, please. So just to say how family-centered services really operate is that early intervention services have to focus on specific identified needs of a family, address concerns, needs developed by child and family-centered functional outcomes. That's critical. That's our work. And current and needed supports identified by the family during the referral and evaluation process. That's the whole family piece. That is the focus of our program, and parents should be included and provided with opportunities to participate in their child's early intervention program, whether they're sessions, which we want a parent or caregiver to be part of, or for any meeting that they're coming to have with us, that at a time that's convenient for them and at a location that's convenient for them. Next slide, please. So these are all of the services that we provide in early intervention. I don't think I left any out, and including transportation. So these are all of the services that we provide. Next slide, please. And where we provide them, our service models are facility-based intervention. That means that there's a facility out there that provides speech, PTOT, and special education services, and a parent takes their child to that facility. Or home-based intervention, where the provider goes to the child's home. Home facility-based interventions, we combine both. We can have a family that might get some home-based services and a facility-based service. And we have toddler group developmental groups that we are comprised of about 6 to 10 children, where that group runs 2.5 hours a day and provides different little sections of like a PT group, an OT group, a special education group, and other related services that are on the IFSP. And that transportation is provided to a family to go to those groups. And parent-child groups is where a parent and a child will participate in those settings. So we only have 2 in Westchester County, one that takes children from birth to age 3, and the other that starts at 18 months. And the toddler group developmental also starts at 18 months. Next slide, please. And the transition plan is, again, required in regulation, and transition is a federal requirement. So transition planning is required for all children exiting the program. And again, not all children exit. They exit in different ways. As I mentioned, some will go to CPSC, to the committees on preschool special education in their local school district, or others will transition to community resources. But in both cases, we have to develop a plan for that transition. And again, not all children will, in the eye, will transition to preschool special education. Now, for those children who are in early intervention and are in the process of transitioning to their committees on preschool special education through their local school district, the only way they can stay in early intervention beyond their last eligibility, their last eligibility date, is for that CPSC meeting to take place the day before the child's 3rd birthday. So for all kids who are on a path to transition to CPSC, they must have that meeting with their local school district prior to their 3rd birthday. And if that happens, that's great. We like that 100% of the time. That's what should happen. If it doesn't, then that child has to exit the program on their 3rd birthday. So for those families then that have been successful to transition their children on time, get to their local school district, have their CPSC meeting, their initial eligibility determination says that the child is eligible for CPSC. At that point, that family has the option to remain in early intervention to the last eligibility date. And usually it's August 31st or December 31st, depending on the birthday, and meetings are happening within those timeframes. But a family also has a choice to move on to the Committee on Preschool Special Education. So that's what choice really means. They have the choice to stay in early intervention, or they do have the choice for early referral and want to move to the Committee on Preschool Special Education. Next slide, please. So now we come to the best part of our discussion here. Let's see. So just to give you what our early intervention program challenges have been. So prior to the EI Hub launch, the early intervention program really we did experience significant provider capacity issues. And most of those issues we would determine were basically based on stagnant, raises and rates that just really had not sustain the early intervention program in the last 30 years. So that problem really was there prior to the launch of the hub. However, the implementation of the EI Hub, our new case management system, which launched on October 15th of 2024, just exacerbated everything that already existed. So the significant impact that we felt as municipalities statewide is that the data migration. What I mean by that is that we had a database system before that, right? So data was being migrated from the NICE system to the EI Hub system. In that migration process, there was enormous corruption of data, enormous errors that were happening that we were not able to manage very quickly. So that increased our administrative burden locally, which meant that we had IFSPs that got stuck. We couldn't move them. We couldn't authorize services. We had no way to get that provider paid. So those were significant migration issues that we saw very early on. And as I said, it increased our abilities, our administrative burden as a municipality locally to use more workforce to really figure out what was happening with these cases and how we can get these families, these cases moved so that these families could have their services. It also affected our workflow productivity. And what I mean about that, our referrals took longer to enter. What a referral taking maybe 3 minutes to enter now took 15, 20 minutes to enter because of the hub's particular way the referral panels were configured. And our program functionality also suffered because we couldn't authorize services as quickly. It took us longer to do all those things, impacting timely services. For the providers, there were cash flow instability. They had definitely provider payment delays and definitely decreased cash flow, and it also increased their administrative burdens. So there was a lot there too for providers, and which led to workforce instability. Providers stopped taking EI referrals. Providers were leaving the early intervention program. We had some providers who stayed with their families and waited for all of this to be resolved, but it did cause an enormous impact to the provider community and instability to workforce. And for children and families, they just had to wait longer times for timely services. We had a decrease in referrals along the way, and that also could have been affected a little bit as we entered 2025 with other kinds of issues related just to world events where we did see a decrease in our referrals, but definitely it impacted our referrals. And it also increased our parent distrust of the system. I mean, we were very effective in working with our families to the best of our ability to ensure that we could get through this, but there were families that were very upset, and rightly so, because it was an impact to them. And also, it's a critical period for brain development, as all of you on this call know, and you know that it's essential. As we said, the mission of our early intervention program is to provide these services as early as possible. So that really impacted the ability for us to do that in a timely manner. Next slide, please. So to date, 16 months later, I'm happy to say, and we thank the Bureau of Early Intervention and PCG, our public consulting group, for having really worked with the municipalities statewide to enhance improvements in EI Hub functionality. We still have a long way to go with some things that we feel have to be more functional for the program, for the software to really work. But we are seeing more timely service authorizations. That's happening. We're having more timely provider payments. But there are still outstanding issues with provider payments that have to be resolved at the state level that the municipalities are not able to do. And those are the current things that we're working on enhancements with the Bureau of Early Intervention, NEI, and PCG. And we've seen improved municipality workflow and productivity. So we are able to now do a referral like in 6 minutes, which is pretty reasonable. And our productivity, meaning that we are able to get through an IFSP and put all those authorizations in place in the time frame that they should be. That's also working. So the system in generally has shown much improvement, but it has really been a struggle for all municipalities statewide. But again, we've had the full support of PCG and the Bureau of Early Intervention to resolve as many of these issues. And that's been working very well. Again, we do have work to do, you know. So we continue to work with the Bureau to complete outstanding EI Hub functionality issues. I think we're waiting for another big package to come out sometime in the spring from PCG of enhancements to the EI Hub, which will help us tremendously in improving our workflow. Also to help providers somewhat during this crisis, where provider payments were stuck and providers were really seeing financial, strains. The BEI issued some provider gap payments, which sustained some of the providers who, especially the smaller providers, who really didn't have the infrastructure or the ability to sustain themselves beyond their early intervention payments. So that's been successful for some. They've participated, but that money came out of county escrow, and that has to be repaid at some point by the provider at some point later on in time. But that helped tremendously for some providers. And we also increased parental consent, the use of telehealth, so that we could encourage families to have a more timely service by creating a hybrid IFSP model. What we mean is that we offered a parent an in-person session and a telehealth session combined in the IFSP, so that if the in-person wasn't really available, that telehealth process platform helped the family. Some families like it, some don't, but consent is required for it. So for those families that consented, it did really assist in increasing or in enhancing our capacity for timely services. Next slide, please. So we're in addressing these workforce and reimbursement challenges in the New York State Early Intervention Program. So we know that we're experiencing ongoing workforce shortages, delayed service for infants and toddlers. That we know that statewide. Reimbursement rates have not kept with inflation, wages, or operating costs, reducing provider capacity. Therapists and special education teachers are leaving for more stable, higher paying positions in schools, hospitals, and private practice. So to be clear, there are many, providers of service in the state, but they're not all really working in early intervention. That's the idea here, that, we'll find speech therapists out there, we'll find occupational therapists out there, but they may not be working in the early intervention program. So what we really want is for more stability within the early intervention program. So more physical therapists, more occupational and social workers, their occupational therapists and social workers and special educators, all disciplines, find the early intervention program as a viable program to, work it with a reasonable wage. So some of the good things that we've been doing is the New York State Department of Health has implemented a rate methodology reform since 2019 and targeted increases to address these challenges. So we've had some increases along the way. They've not been substantial, of course, and they can't really, support a program if they're very minimal. So more needs to be done, and that work continues. So recently, as of yesterday, I think, or the day before, the Bureau sent out to the field or announced that the 4% rate increase retroactive to April 1st, 2025 for EI eligible children is in place, and these services will be made payable to EI providers starting March 18, 2026. And that 4% rate increase is the underserved areas, the rates that we've worked for to ensure that we could address the needs of those children and families in underserved areas. Next slide, please. So we, again, have to have sustainable competitive rates in order to rebuild our workforce. That's just a given. There's no way out of that. We need to do that. We need to have parity across disciplines and in pay and some ability to energize the workforce to really come back to early intervention. So that's critical. So that 5% increase has not yet been implemented in actual provider payments. I think that's still stuck in CMS. So we're still waiting for that 5%. I think there's a bill currently for in-person services in the Senate, I think, to ask for an increase to 11% for in-person, which we all would agree is absolutely critical to do. So there's things that are happening to really, ensure that we are trying to meet these challenges and ensure that we're working towards a restoration of perhaps reimbursement rates that can help providers want to be a part of the early intervention program. Again, we know that I think one of the things that we're certain about, if we continue our collaboration with stakeholders, families, providers, legislators, the Bureau of Early Intervention, we're all invested in this. We want to ensure timely services for every eligible child. And if we can make that investment, it would really reduce the need for continued or more expensive services when children enter preschool, when children enter school age. So that's pretty well documented in research that makes sense to do. So that's really what our challenges and some of our improvement strategies that we're looking to do. Next slide, please. So I just wanted to provide you with information about the New York State Early Intervention Coordinating Council, the EICC. Excuse me. So the EICC is an advisory board that supports and guides New York State's early intervention program. It advises the Bureau of Early Intervention on policies and regulations related to early intervention. It recommends strategies to strengthen service delivery, workforce capacity, program quality. It helps ensure eligible children and toddlers with developmental delays receive appropriate timely services. And the council plays a key role in shaping policy and addressing system-wide challenges affecting the early intervention program across New York State. So, next slide, please. These are two critical task forces that currently are operating in the state EICC, the Provider Workforce Capacity Task Force. I'm co-chair of this task force along with my co-chair Lydia Letniak in New York City, and we've done extensive work since 2020 on developing different recommendations to different recommendations to increase capacity. And so I invite some of you to also go to the New York State Department of Health website. There's a site there on the navigation bar where you'll see the EICC, and it has all of our workforce task force capacity workforce that we've done so far. We have the rate setting task force as well, and they're charged with ensuring that we can look at current rate methodology and do an analysis of what's needed in various regions. And then, we have made recommendations for a 4%, a 5% increase. And our objective is to ensure that rates are equitable and efficient and cost effective. So these meetings are public meetings. You can look at the website, you can look at our work, and I encourage anyone that's interested in what we're doing and how we're working with the Bureau of Early Intervention to address capacity and rate setting, that it helps you understand our work a little better. Please visit the website and look at some of our stuff. Next slide, please. So this is just to give you a little bit of information about the provider capacity or approved providers in New York State. We did a snapshot of this on the central directory. Where all the early intervention approved providers are placed by the Bureau of Early Intervention. We did this on the 22nd we ran the list on the 22nd of February, and this is what we're seeing now, is statewide who's approved, a number of providers, agencies, and those where you see Westchester County. What that simply means is that 125 means that those EI approved provider agencies, 125 of them have a catchment area of Westchester. Also, we share providers across counties. So the same provider agency that has a catchment area of Westchester also has one of other counties. So currently we're seeing that there are 125 available agencies to us in Westchester County. Within those agencies, there are multiple providers of service that work for them. Municipalities, that 57 is all municipalities do initial service coordination, and some of them could do, other services for early intervention. So this is just to give you an idea of who's statewide, the number, and how many we do have in Westchester County. And we keep track of this because when we can't find like someone who we might need, like say teacher of the deaf that or hearing impaired that we don't really have. Most of these kids might be seen by a speech language pathologist, so that might be happening, but we might need someone who might have that certification. We can reach out to the Bureau to ask if there are any other providers that are either coming onto the list or they're anticipating. And why we say subject to change daily, because there's always a workflow that's back-ending new providers coming in, and the Bureau of Early Intervention keeps every municipality very updated on the new providers that are entering the system. And they have an active campaign statewide to attract as many providers to enter the world of early intervention and become an EI provider. Next slide, please. So this is just a little bit of Westchester County data. So if you look at the number of children, we did, 22 to 23 school fiscal years, and we looked at the number of kids that were referred, and you could see that we had between 2024 and 2025, we did have fewer kids entering the program. And I think that we, as I said earlier, we began to hear from families that they were afraid to enter the early intervention program. Some families had entered and then dropped out. And the next number you see, total of number of children not evaluated. Let's say for 2025, out of that 3,264 kids that were referred, that 429 kids that were not evaluated, some of those families could have moved to another county, they could have just declined, but we were seeing a good number of families just not coming forward because they were afraid. And the total number of children evaluated for 2025 was less, of course, because we had fewer referrals, 2,835 kids. Of that, 2,081 kids were found eligible. Again, a drop from last year. And then the percentage of children found eligible overall is 73.39. And so we're keeping our eligibility rate pretty stable, which is really good. That means that kids that are coming in and referred are being found eligible for the program correctly. Next slide, please. So this was also a snapshot that we do. We did the third and fourth quarter of 2025. We're getting now prepared to do the first quarter of 2026. Will be January, February, March. At the end of March, we'll do a same snapshot this way, but we're looking at kids who in the third quarter and fourth quarter who did not receive their services within 30 days. And we keep track of that. So in the fourth quarter, which is, October, November, December, sometimes what we find that happens within that time, we have more families who are either the holidays or just going away periods of time. Same thing kind of happens in the summer, but usually around November and December, we have longer waits. So that simply happens that way. I think we feel that those kids, although they were not served in 30 days because the families weren't available, or because we couldn't find a provider, either way, they were served at some point within 60 days of their service. Again, we are out of compliance because that is a federal mandate and we're keeping track of it. But there are many reasons why a late start of service can be happening. Provider capacity for sure. And then there could be family reasons. And then again, families do go on extended vacations and that does interrupt the process. Next slide, please. Thank you. And if you have any questions, do we have any time left, Angel?
So we have gone slightly over, but there was just one question. but I believe Stephanie had to leave early for a meeting, so I can connect the two of you. Just around questions where folks were receiving virtual services during the pandemic, and she was looking to see if the IEP services would transition back into in-person only in the future, but we
Oh,
can follow with her.
yeah, I can connect with her.
Okay, awesome. And that was the only question.
So here are our websites. Please check them out. I think you'll find everything that I talked to you about today clearly spelled out. And thank you very much for having me.
Thank you, Marina. We truly appreciate all that great information you were able to share with us today. Certainly a lot. And in true WC fashion, we are certainly advocates, and there are opportunities to advocate with us utilizing the QR code that is currently on your screen. As Marina had mentioned throughout her presentation, there is a lot of issues with the workforce part of things, as well as keeping the rates at a reasonable amount and receiving the funding that was once promised. So we do want to advocate, and I will drop that link in the chat as well, if you are still around. And again, we thank you all.
Thank you.
Thank you, everyone.
All right, have a great day, all. And we will certainly follow up with more information. And we hope that you stay connected with the work that we are doing throughout the county. And if you thought of any future possible partnerships, please feel free to reach out to anyone on the WCA team. Thank you and have a great day.